Guess what, everybody? This is Dr. Val Jones, as you know, reporting to you here from HIMSS. And yes, cuddle up. I'm here with Dr. Danny Sands from Cisco, and I know you've been all looking forward to hearing what he has to say. As you know, Dr. Sands is ePatient Dave's personal physician. ePatient Dave, of course, was here, made a cameo appearance earlier on today, and I know you were all very excited to talk to him. We had a lively discussion about the importance of the doctor-patient relationship and how we need to partner as closely as possible with our patients in a respectful way to make sure that they get the care that they need. And so Dr. Danny Sands is going to tell us a little bit about what's going on, what's hot with Cisco. And then we'll entertain questions from you guys in the chat room on Twitter and out on Facebook. And we will go from there. So to begin, Danny, tell us what's hot at Cisco.
Everything's hot at Cisco, Val. It's a very exciting time for health information technology, and we're doing so many interesting things at Cisco in the Internet Business Solutions group that we're a part of. I'm sorry about that. Technology gets in the way sometimes. In the Internet Business Solutions group that we're a part of, we're doing we're in charge of sort of trying to figure out where healthcare is going and where are the needs. And one of the things we're thinking about is the limited resources in healthcare and how we can extend them. We're thinking about how the healthcare world is not patient-centric, and that we don't focus on the patient as a customer. We don't think about partnering with the patient enough, and we don't make it easy for patients to either get engaged in their health or get engaged in care. So there are other things, of course, that we're involved with, but that's enough to get us started at least.
Absolutely.
So, care at a distance is part of this. Online patient services is part of this. As you know, we have a new initiative called Cisco Health Presence, where we can provide care at a distance to people using a technology that really recreates what a doctor's visit is all about. But really, we're here to talk about ideas and the things that healthcare needs in order to move to the next level.
So, what does this technology look like?
Cisco Health Presence?
Yeah.
What it looks like is a TV screen. And actually, you can see this if you go to Cisco's website, cisco.com. You can actually look up Health Presence, and you can see what it looks like. What it looks like is
that looks beautiful.
I'll show you a picture of this. What it looks like is it looks like a TV screen. It's a high-definition TV screen. And as a patient, you would, instead of going into a doctor's office, you'd go into a Health Presence office. And we'll get to where that might be in a moment. But the person who's there would be an assistant, like a medical assistant, for example. Could be a nurse, but it doesn't have to be. And that person would orient you, greet you, and would connect you to any equipment as necessary to evaluate you physiologically, whether it's listening to your heart or checking your vital signs or looking into your eyes, whatever. And at the other end of this, there's a doctor who has a similar setup. And this doctor is also in front of a high-definition screen. And once the assistant makes the connection, you're connected. But you're connected not in a way that sort of is this fuzzy, jerky image. It's not like a Skype or something like that.
It's not like what we're using?
It's right. Not yeah, not like that, right. But now this is good, right? Because it's better.
This is a plea for Cisco to help us.
Right.
I mean, we have to see we need to see the dire situation that we're in right here.
But imagine you think about the difference between standard definition TV and Blu-ray or even a high definition image. That's the kind of thing. And so you're moving from something that's worse than standard definition to some extent because you have jerkiness and latency and things that get in the way to something that really feels like we feel right now, where we're very close and connected. So much of what we do in healthcare depends upon the human connection. So much of what we do in a healthcare encounter has to do with trust, establishing and maintaining trust. The only way that you really can do that is if you feel like you're with the person. If we'd never met before, I could talk to you on the phone, but frankly, it's going to be hard if we've never met before to establish that trust. But if we're in the same room and we're looking into each other's eyes, you can establish that trust. It's just a very different thing, and that's what we can do with this technology. If you think about the encounter, and you know this as a doctor, right? 80% or more of the information that we get comes from listening to the patient, asking the right questions. And then you get a little bit more from observing them and doing the physical examination, right? And then a little bit more from ordering tests. Now, if you can not only really ask the right questions and really be present with them, through this technology. But then you can enhance it because we can actually do the physiology. We can do, I can't lay hands on you, but I can have my assistant lay hands on you, and I can do other things to evaluate you, listen to your heart, listen to your lungs, and so on. Then we're really getting so much of the visit that's necessary. So we can help you in a whole lot of different situations. So I think this is a very important technology because it enables us to provide care at a great distance. And because you can be anywhere and I can be anywhere as long as we have this technology there. What it's not for is it's not for, I'm sitting in front of my TV on a Saturday night and I want to connect with some doctor today because I have a stomach ache because of my Doritos that I've eaten, right? It's not that. It's different. This is a step up from that. This is really an encounter. But in so many situations, doctors aren't available, specialists aren't available. But using this technology, we can actually have you go to a local office, get care from a specialist who might be hundreds of miles away.
So do you see this as improving access to specialists, or do you see this as improving rural access to physicians where there may not be enough?
It's both. So the ways in this can be used are many. So one is providing access in areas in which we have a maldistribution of resources. We don't have the resources. So we know that in the U.S. and actually most countries, you have plenty of doctors in big, attractive metropolitan areas. But in rural areas, you often don't have enough doctors, particularly specialists. But in fact, there are urban areas even that are underserved. There are parts of the U.S. that are underserved urban areas because there's a lot of there are cities that are struggling without naming names, and it's
Detroit.
We could name that, but
Sorry.
We're on the web. So that's exactly right. And so how do we provide services in those areas? So any time you need to get healthcare delivered in an area where you don't have the human resources, you can do this. So it might be urban, it might be rural, it might be a correctional facility, it might be a retail setting, a shopping mall, it could be a nursing home, or an assisted living facility. Could be a school. Because in some cases, it's not that doctors won't go there, but it may be impractical to staff these places with a doctor or even a nurse practitioner full-time. Another example would be an employee health clinic. In fact, at Cisco, we're using this in our employee health clinic. In several of our clinics, we're using this to connect people at the Cisco office to a doctor who's located off-site. Right.
Lots of stuff going on the chat room.
Okay, I think we're going to take a question from the chat room. Dr. Anonymous?
I can ask this. So the question is, how did you include patients or their needs in the design of this product?
That's a great question. And let me just say at the outset, this is a platform. So that this is when we look at health presence, we think of it really as a platform to deliver care. It is not a finished product in any way, and as a platform, we can change it all the time because there may be situations in which we want it to be configured one way versus another way. We have different types of instruments that we use in different settings. So I will say that in the development of this platform, we have not had a lot of patient input, but through the pilot projects, we're learning a lot from patient experience. And one of the things we're learning, and this is kind of interesting, is that there's an over 90% satisfaction rate. It's close to 100% satisfaction rate with patients who see a doctor through this through Cisco Health Presence. Now, interestingly, if you ask patients about their satisfaction rate when they see doctors face to face, it's not always that high, as you know, unfortunately. So it is interesting. And I think that if you look at the patient experience, there's another interesting aspect of this.